According to WHO, globally, heart disease is the leading cause of death, responsible for nearly 18 million deaths annually. Surprisingly, a significant portion of 10% to 50% of heart attack signs remain undiagnosed. Heart attack is not a disease, but an effect of several symptoms that can be caused by diseases or injuries. It occurs when blood flow to a part of the heart muscle is severely reduced or cut off completely. This lack of oxygenated blood, essential for the heart's function, begins to damage the heart muscle, leading to their death. The heart is a delicate organ and must not be put at risk. Thus, we bring to you 5 critical signs of heart attack that you must not ignore. Number 1 is the most important. But before moving on, please note that the information provided in this video is fact-checked by experienced healthcare professionals and is for education purposes only. Number 5. Breaking out in a cold sweat. Cold sweat is often dismissed as a mere response to a hot environment or nervousness. But this seemingly unrelated symptom can be your body's response to the stress of a heart attack. The psychological response triggered by the nervous system when it sees heart muscles dying or under stress involves the activation of your body's fight or flight response. When this happens, the system is in its desperate attempt to push the body to action. The sweat glands located throughout the skin are activated. This widespread activation leads to profuse sweating, even in the absence of heat or exertion. Imagine beads of sweat forming on your forehead, palms, and even back, despite being in a comfortable environment. While the initial burst of sweat might seem like a temporary response, it often persists in the context of a heart attack. This prolonged sweating can be attributed to 2 factors. One is ongoing stress, where the body remains in a heightened state of alert due to the ongoing tissue damage and oxygen deprivation in the heart. This sustained stress response keeps the sweat glands activated, leading to a feeling of constant clamminess or dampness on the skin. And secondly, the circulatory changes happening. The blocked artery disrupts the normal blood flow throughout the body, including the skin. This impaired circulation can lead to a sensation of coldness, even if the body's core temperature remains normal. Unlike sweating from exertion, this cold sweat appears abruptly, even at rest. It's excessive and doesn't resolve with rest or cooling down. The skin feels clammy and cold to the touch. Remember, cold sweat rarely occurs alone. If it appears alongside other classic heart attack signs, it's probably time to call an ambulance and get immediate medical attention. Number 4. Unusual fatigue and weakness. Tiredness is a common effect of our busy routines, but persistent fatigue unrelated to your usual lack of rest can be a critical sign of something far more dangerous. The main cause behind this unusual tiredness is a condition called hypoperfusion. It is when your vital organs and tissues, including your muscles, don't receive enough oxygenated blood. During an attack, when the oxygen-rich blood supply to the heart muscle itself is compromised, either by a clogged or narrowed artery, the body, in its desperate attempt to prioritize blood flow to the struggling vital organ, diverts it away from other less critical systems, like your muscles. This redirection of blood flow explains the sudden, unexplained weakness associated with heart attacks. Imagine feeling drained and dizzy even after minimal activity, like walking a short distance. It's not just laziness or lack of nutrition. It's your body conserving precious oxygenated blood for the failing heart muscle. In this case, even sleep offers no help to make up for your lack of energy, and it's not just the disrupted blood flow, but also hormonal imbalance. The stress response triggered by the heart attack leads to the release of stress hormones like adrenaline and cortisol, which can initially mask fatigue but ultimately contribute to long-lasting exhaustion. Moreover, the body's inflammatory response to the damaged heart tissue can also contribute to a general feeling of drowsiness and fatigue. Ignoring persistent, unexplained fatigue along with other important signs can have dire consequences. Remember, your body is sending you important signals. Listen to them and seek help if something feels off. Number 2. Nausea, vomiting, or indigestion. While nausea, vomiting, and indigestion typically point towards stomach issues, these seemingly unrelated symptoms can also indicate a heart attack, especially in women. The connection between our heart and nervous system is mainly responsible for these simultaneous symptoms. Similar to shortness of breath, when heart muscles are put under stress during a heart attack, they send signals and initiate a psychological chain reaction. The same stress hormones, while essential for mobilizing the body's emergency response, also have downstream effects on the digestive system by slowing down the defecation process. This can lead to nausea and a feeling of fullness, even after eating little or nothing. Furthermore, they increase the production of stomach acid, triggering heartburn and indigestion. In severe cases, the body may attempt to stimulate the vomiting reflex, where it urges expelling what it perceives as toxic buildup, leading to vomiting. While women are more likely to experience these atypical symptoms during a heart attack compared to men, it's crucial to remember that both genders can exhibit them. This highlights the importance of not dismissing seemingly unrelated symptoms. Unlike indigestion from a heavy meal, these symptoms appear abruptly and unexpectedly, often without any obvious trigger. The nausea, vomiting, or heartburn feels more intense and doesn't resolve with typical remedies like antacids. Remember, these digestive issues rarely occur alone. If they appear alongside chest pain, shortness of breath, or unusual fatigue, seeking immediate medical attention is crucial. Number 2, shortness of breath. Feeling like you can't catch your breath could be a warning sign. This often accompanies chest pain, but can occur independently. At rest, your body maintains a delicate balance between oxygen intake and usage. However, during a heart attack, when the artery that supplies blood to the heart becomes blocked, oxygenated blood struggles to reach the heart muscle. This lack of oxygen doesn't just impact the heart's functionality, but also triggers a series of physiological responses, one of which is excess fluid building up in the lungs, significantly hindering oxygen transfer. This fluid buildup isn't just uncomfortable, it's a desperate attempt by your body to compensate for the oxygen shortage. The result? That painful feeling of air hunger, the suffocating sensation of not being able to breathe fully, even at rest. Unlike breathlessness caused by physical exertion, this symptom appears abruptly and might take you off guard. Even simple tasks like walking upstairs or getting dressed can leave you struggling to breathe. In severe cases, breathlessness can worsen when lying down, forcing you to prop yourself up to ease the discomfort. This is due to the increased pressure on the fluid-filled lungs in this position. It's essential to differentiate a breathlessness from other respiratory symptoms like coughing. While a heart attack can sometimes cause a dry cough, the presence of wheezing, phlegm, or fever suggests other possibilities. The key takeaway here is to be mindful of sudden difficulty breathing that wasn't triggered by exertion, especially if it is accompanied by other heart attack symptoms mentioned in this video. Number 1. Chest discomfort. Chest discomfort is often described as pressure, squeezing, or stabbing pain, and it stands as the most common red flag for a potential heart attack. The main cause of this discomfort is ischemia, a condition where a tissue doesn't receive enough oxygenated blood. In the context of a heart attack, this occurs when the artery, responsible for supplying blood to the heart muscle, becomes blocked or significantly narrowed, usually due to a buildup of plaque. As oxygen-starved heart cells struggle, they send out distress signals interpreted as pain or discomfort. This feeling of discomfort has classically resembled the metaphor of an elephant sitting on your chest. But the reality is that chest discomfort during a heart attack can manifest in diverse ways. The discomfort can be felt in the center or left side of the chest, but it can also radiate to other areas, including the jaw, neck, back, left arm, or shoulder blades. This is due to the intricate network of nerves supplying these regions. It is also important to not ignore even the slightest signs of discomfort, as the pain often isn't a sharp stabbing sensation, but rather a dull ache, pressure, or tightness. It can be intermittent, coming and going in waves, or persist for several minutes. Underestimating or dismissing subtle chest discomfort can have dire consequences. Early recognition and intervention are crucial for minimizing heart damage and improving outcomes. And there you have it, 5 critical signs that are your immediate call to visit the hospital as soon as possible. Keeping an eye out for them might save you or your loved ones from serious complications later on. Don't forget to like, share, and subscribe to my channel for regular important health-related tips and hacks. Until then, stay happy and healthy.